heroes going out and sort of fighting the villain of COVID wherever you are. And so just want to appreciate again and again all the good work that you do. And you are the superheroes of this fight. So welcome. And just want to remind folks to mute themselves. We allow children and pets to share the screen, but we prefer not to have them share the audio. And as we do each week, we just want to start with a moment of silence to remember those professionally and personally that we've lost to this pandemic. So join me for a moment of silence. Okay, thank you very much. Now I'm going to revert back to Bruce Wayne, and we'll continue with our agenda. Those of you who have been on the call, it's the same format that we've instituted since the beginning. Just a reminder that because we've jam-packed these hours with so much information, we're now doing a every other Friday with updates from all of our partners, and then the following week we'll have a dig in that we're calling strategies on the ground. And so next week we'll have strategies on the ground related to a topic of interest, which is trauma-informed care during the crisis. So stay tuned for that. Today's going to be a little more dense, but we're thrilled to have someone from DSS join us and spend a lot of time on the good stuff that they're doing. So welcome, and just there's a few slides of announcements that you'll see forwarded on by Suzanne. We have a recent, recently updated, just a reminder that we send out the link to the slides and that these links are live in your slides. So if you click on them, you'll go directly to the CDC's updated information. We won't spend any time unpacking that, just letting you know that it's there and available to you. We had a really good question in the chat box last week about how do you get consumers and folks in your programs to adhere to the transmission. So Suzanne's going to advance the slide. And in this, again, you see that there's a link at the bottom. If you click there, you'll see a well thought out document that really helps you work with folks who are having a hard time to do it from a trauma-informed, harm reduction-informed perspective. So thanks to everyone who put that document together. Thanks to Susie who asked the question. A reminder, we do have a chat box. If there are questions that you want to ask that we can answer directly, we will. Otherwise, we'll go back, we'll research it, we'll come up with an answer if we're able. Some of us are going to spend a lot of time together. We have the
John?
regular, yes.
Hi, it's Alice. I just wanted to say, well, that document is fantastic. And, you know, in the document, it talks about the shelters and, you know, being like for congregate setting. I think it's really good information for the single site provider, the single site buildings to adhere to as well. Some of that is a lot of overlap, or, you know, you can use it for when you're working with somebody in your office. So I just want to say, while it talks about shelter stuff, it really does translate to other and permanent supportive housing programs. So I just wanted to jump in with that. Thanks.
Okay. Thanks, Alice. So some of you will be spending a lot of time with us today. We've got the annual meeting today from 12:30 to 1:15, so we hope to keep that an abbreviated 45 minutes. And then next week, next month, we'll have our semi-annual meeting on June 19th. And again, all of this information is available. The links are live. I believe that we send out a calendar invitation that if you accept it, it becomes embedded in your calendar. So stay tuned for that. Just a reminder, anybody who wants to take over this hot seat and keep these meetings running can nominate yourself to be one of our co-chairs. I'm sure that Steve DeLella and Alice Minervino would be happy to relinquish their seats for other co-chairs as well. Although we do try to have a mix between community provider, which is the seat I sit in, and state providers. So, but we do encourage folks to submit nominations. This is an open and honest and transparent process. We've got lots of information coming at us through various webinars. I see that on Monday, we've got a little bit of a conflict with 2 of them. So if you are able, send a staff person to one addressing racial disparities and another to the Connecticut Association for Human Services on how to maximize folks getting their returns. Just a quick plug on that. So VITA, Volunteer Income Tax Assistance Program, obviously was impacted by COVID. They have now gone virtual. So folks can have their taxes done virtually. And this webinar will explain how that happens, and we'll try to enlist all of us to be influencers, as they say, to get our consumers to actually feel comfortable doing virtual tax returns. So jump on that one if you're able. Again, a reminder that anything you send to us, we try to get back to you on. We are keeping a running list with all of your questions, and there's a link on the next slide for where you can go to see the historical perspective. There you go. Our email address. So when those of you are waking up in the middle of the night from your COVID dreams and you have a question for Housing Innovations, you can go and send them, or all of us, an email, and we'll get back to you as soon as possible. Great resource from HUD. And I'm thrilled that we have our HUD partner on the call with us each week. So we look forward to hearing an update from them. So without further ado, Steve, you want to give us the CT Department of Housing update?
Sure. So I think the couple updates that we're at here now are funding. I know the providers who are providing assistance to the shelters and the cans have been interested in getting the reimbursement for their additional COVID costs. So the cans all submitted that information to DOH 2 weeks ago. We've been working with OPM to get that funded. The OPM has some questions for us that we're trying to resolve. So hopefully they'll give us be able to contract out that funding shortly to get everybody kind of back up to speed. The next step is the hotels are set to expire at the end of the month. However, we are interested in asking FEMA for an extension for 1 additional month to take us through the end of June. So CCH and DOH are working with Demis to get a letter out to FEMA. So hopefully that will happen and will get extended. And then we are also part of that. We really want to create a pretty expansive testing program for folks in the shelters and hotels. We want to make sure that everybody gets an actual test. So we're working with Demis as well on that to create a protocol working with the cans that will get everybody who's in a shelter or hotel tested. That way we'll be in a better spot to send folks back to shelters if we're not unable to house them. And that leads to the last piece is in the next 6 weeks, we'll be partaking in a large housing position to try to get as many folks as possible housed out of the hotels and out of shelters so we can create as much space as needed. We have the additional resources through ESG. We expect to receive more, and we're continually looking for additional resources to get people housed out in the community. So that's where we're at today.
Great, thanks. And just a reminder, in the chat box, we do have a link to slides. So if you're not able to access them any other way, go to the chat box and click on those. Alice from Demas, are you the spokesperson today?
Yes, I can be the spokesperson today. I can be very brief, talking a little bit about funding to follow up with Steve. Demas yesterday applied to SAMHSA for some FEMA funds for very short-term crisis counseling interventions. It was a really short turnaround, and so I appreciate anybody, especially CCH, who I called like very last minute and asked for some data, and they turned it around super quick for me, so that was awesome. All of the folks at Demas that worked on the grant, I really appreciate. So we're gonna find out if we're gonna get these crisis counselors. They'll help with people who are in motels and transitioning out. They'll help, and it has to be very crisis focused, very focused on the COVID-19 pandemic. But they're going to help people with linkages to ongoing resources, but really crisis driven. So we'll hear about that. I think that's it for our Demas updates for this week. We've really been pushing to work on that FEMA grant. It was just short, as I said, a short turnaround, and so that's been our focus. So if Alana or someone from HUD is on, I can turn it over to them.
Good morning, everyone. Thank you, Alice. This is Alana Cable from the Hartford CPD office. First of all, I'm very pleased to report we've received our first CARES Act amendment submission. That came through today from the state of Connecticut, so we will get to work on that right away. We did have a very extensive detailed training this week on how to submit a CARES Act amendment to HUD. Went through some particulars, especially important for ESG grantees that are applying, how they set up the projects in our information disbursement information system. So we gave very detailed instructions on that, and I'm going to send those out to everyone as well today. So we expect to turn the state around fairly quickly and get those grant agreements off to the Department of Housing. We also have, again today, as we've been having weekly, we do have homeless assistance providers office hours. Today, that's from 2:30 to 4 p.m. We did have HAPWA training because HAPWA office has actually published their notice. CDBG is a little bit behind that, but they hope to have a notice off to us shortly as well. However, that does not preclude anybody from applying for their CDBG COVID funds. We've given everyone the parameters that we do have available at the current time under which they can apply for funding. At the same time, the Hartford CPD team, is also processing the 2019 COC grant awards. We've sent 42 out. We've gotten 40 back, submitted those to our accounting office in Fort Worth, and they're now working on the next tranche as we received an overview report from headquarters last week. CPD.
That's all? Come on. You guys are slapping. You guys are doing a phenomenal job. And again, we're so thrilled that we've got a good partnership with you. If there's anything we need to do to get those last two in, let us know. We'll kick some butt. Okay, who's here from CCEH to give us an update? I see Sarah.
Sarah.
Is David on? Sarah, take it away.
Hold on. Oh yeah, you guys can hear me, right? I'm unmuted.
You're unmuted.
Yep. Oh, thank God. Okay, so several things. I have an HMIS update from Linda that I need to share. So the HMIS changes are in place for the COVID response to capture testing results. I don't think Steve shared this earlier, but the Department of Housing wants everyone who is still in hotels to use the smart sheets for the exit and destination marking. But we're moving into a new phase, and everything is at the release notes, and the webinar on this are all at CTHMIS. So you can go there for all of the information. I do not have it all, so I won't pretend that I do. Liz also wanted me to share and they're also, all of the information on the HMIS COVID-19 changes are also in the weekly digest on COVID-19 that CCH has been sending out. We also have a few webinars that are coming up to provide assistance, and our webinars have been gaining a lot of traction. Our upcoming webinars include a webinar on addressing racial disparities in homelessness during COVID-19, and that'll take place, hold on a second, on Monday, May 18th from 1:30 to 2:30 p.m. And then, one second longer, should have written myself more comprehensive notes. And then the other upcoming webinar is a verbal de-escalation and crisis prevention during COVID-19. And that takes place on Wednesday, May 20th from 1 to 2 p.m. We at CCH are working with everyone to get everyone housed as quickly as possible. We also are still working closely with the Department of Housing and Department of Public Health to ensure that people are maintain safety and really looking at isolation spaces and health considerations and partnerships with hospitals with all of our partners. And I do have something that I think you, John, in particular will enjoy with your focus on self-care. Hold on, I put myself right out of being able to see everyone. So this Saturday, CCH is launching like a new fundraising, a new way of raising money for our rapid exit and COVID response funds. We're doing fitness challenges and challenging gyms across the state to hold workouts with all the proceeds going to the fund. Tomorrow, my gym, North Haven CrossFit, is actually holding a workout and it's virtual. Everyone can join. It's going to be for all fitness levels. We've raised 1,000 so far, but my goal is, of course, far above that. So if you go to the CCH Facebook page, you're more than welcome to join us for the workout, and all the information is there. It's the way that I'm maintaining my sanity with having a newborn and all this going on with COVID. So I just, I can send the information to Liz to share if anyone would like more further information on it.
Great, thanks, Sarah. That's
You're welcome.
actually a good segue into, let's take a minute before we do a deep dive with our partner from DSS, because she's going to go through so many slides, your head's going to spin. Just remember that it's all written out. It's not, there's no test at the end of it. This is, the idea is to get as much information as we can to you quickly, but for you to digest it later at your leisure. So before we do that, let's just raise our hands to the sky. Come on, I can see all of you. Jim Pettinelli, raise your hands. Kyle, let's go, raise your hands. Just stretch. Paul, raise your hands. Just, all right, good. You know your breathing exercises from our previous weeks, so continue to do those whenever you feel a little stressed out. Not that there's any reason any of us should be stressed out. Okay, so without further ado, let's move to our presentation from Kristen Dowdy from DSS. Welcome, Kristen.
Good morning, thank you. On behalf of DSS, I'm so excited to be here this morning. I think this might be my very first housing meeting in my almost 15-year career at DSS, so thank you for such a warm welcome. I'm happy to talk today about the availability of our Husky Health coverage, which is especially important, as you know, during this time of public health crisis. As many of you are probably aware, Husky Health is Connecticut's Medicaid and Children's Health Insurance Program. It provides comprehensive health coverage to over 1 million Connecticut residents each year. Consumers may apply for Husky Health during the year at any time. There is no open enrollment period like with other insurance options. We'd like to say that every day is open enrollment for Husky Health. I've included some important information here within the slide that you'll see, but the quickest way for individuals to enroll in Husky Health is through Connecticut's Health Insurance Marketplace, better known as Access Health CT. Individuals who apply through our partner agency, Access Health, will have their eligibility determined real time immediately. At the end of the application, individuals will learn if they qualify, and if so, can immediately enroll. Their enrollment is immediately available in our systems. Coverage is active and viewable by providers if they check. They also receive hard copy notices in the mail that can act as a guarantee of payment as needed, if that's needed as well.
Kristen, just let me know when you want the slides to advance. I'm kind of just guessing, so sorry if I'm off.
Sure, you can move right up to around, let's say, slide 5 right now. And I'm trying to go quickly. I know that that time is limited. So, but like was stated before, all the information is here for people to reference. So recognizing that healthcare coverage is critical during times of public health crisis. Like right now, DSS worked with the Centers for Medicare and Medicaid Services to ensure as many Husky Health enrollees as possible could obtain and retain their health coverage during the COVID-19 emergency period. CMS authorized disaster-related enrollment flexibilities, as they're called, that we implemented effective March 18th, which will continue throughout the duration of the federally declared emergency. And I'll hit on a few of them, and certainly the full list is available on our website. But two of the main things that we did was to make sure that we extended everyone who was enrolled in Medicaid or in CHIP to ensure that if they were up for renewal, that they didn't have to go through a renewal immediately. We extended their coverage end dates by 3 months, and will continue to cover it, extend them as necessary for the duration of the emergency period. Obviously, we don't know when that will officially end. We also delayed taking action on certain changes. So for example, if an individual's income increased to make them ineligible, or they aged out of a certain program, we wanted to ensure that they stayed enrolled and covered, and we are ignoring or delaying certain changes for the time being. You can move to slide 6. We're taking some additional actions that we would normally, we've delayed, that we would normally take during the eligibility processing process. But I did want to point out that we are covering COVID-19 treatment and testing without copays. There's never a copay in Medicaid. And the copays that do exist in our children's health insurance program, also known as Husky B, have been waived. So there's no copayments right now in our CHIP program. Slide 7. In addition to the enrollment flexibilities that were mentioned just previously, we also submitted a section 1135 public health emergency waiver to request other flexibilities that affect our provider community. We were given the authority to waive various prior authorizations and to serve Husky Health members in alternative settings, such as a shelter or a vehicle. We've been able to defer certain provider recertification processes and be more flexible in the way that we enroll new providers. And we've streamlined some other administrative procedures, such as timeframes around requesting fair hearings. So there's a lot going on. And again, please reference our website for additional information. But also very important that I wanted to mention today is that on May 8th, the department implemented an optional Medicaid coverage group. It's called the COVID-19 testing group for the uninsured Connecticut residents. And it is also effective March 18th. This optional eligibility group is a Husky limited benefit group, which means it only provides limited benefits. It only provides coverage for testing of COVID-19 and in the office visit related to the testing. To qualify, individuals must have no other health insurance and must be a resident of Connecticut, a U.S. citizen or a non-citizen with a qualifying immigration status. Non-citizens with qualifying immigration statuses include, but are not limited to, legal permanent residents or green card holders. Or there's another category that we're covering with a limited benefit, and that is for individuals without qualifying immigration statuses, but they have to otherwise meet our Medicaid or Husky Health income requirements for the relevant household size. To apply for Husky Limited Benefit COVID-19 coverage, individuals must complete a full Husky Health application. So that's why I've included information about how best to apply. If an individual is denied for the full Husky Health program benefit coverage, all applicants will be considered for this new limited benefit COVID-19 testing coverage separately. Applicants will receive a separate notification of eligibility for that. So they might receive a denial immediately or in the mail, but then they will also receive a second letter separately indicating whether or not they qualify for the COVID-19 limited benefit coverage. I have included also here a sample of the ID card that they will receive. So it does look a little different from our other cards. It indicates Husky limited benefit, that there's no cost share, and that it is specifically for COVID-19 testing and that related office visit. I would encourage you, again, like I've mentioned a few times, to check out our website for more information, a full listing of all of the measures the DSS took to streamline administrative processes for both consumers and providers. And I'm happy to take inquiries, however that is done best, whether it's questions right now at the end, or if you want to contact me directly by phone or email.
Kristen, thank you. Wow. You are welcome to be a presenter with us at any time you like, because you did such a good job of staying on time.
I feel like it was a speed session, so please don't hesitate to reach out with questions.
Great.
Thank you.
Are there any questions in the chat box that we need to address at this time?
A couple people, even though we posted the slides, said they couldn't get them, so we reposted them. So if people still can't get the slides, just give us a note in the chat box and we'll repost them. And I think someone was saying that the link to the guidance on supporting adherence was not working on the link. So we'll, Liz, I don't know if we can just put that document right up, or Lauren, if we can actually just put the file up right now, and or the link. I did have one question for Alana. Alana, if you're still on. John, am I allowed to ask a question?
I am. Yep, I'm here, Suzanne.
Yes, Suzanne, you're allowed.
So Alana, great to hear your voice, and thank you for coming. So one thing, do you have any idea about the notice of the competition for 2020 for the Continuum of Care funds?
I have not heard anything about the notice for the 2020 competition, but I'll be happy to inquire about it today and let you know what I find out.
Okay. Great, thank you.
You're welcome.
Great. Okay, so feel free to keep using the chat box, and we're going to move on to the balance of state updates and reminders, which may be a little bit redundant with the next meeting, but we know that not everyone who's on this call is going to be able to take another 45 minutes out of their day with us. So we've snuck a few things in that normally would be on the steering committee agenda and is in that slide deck. So I think Suzanne and team will take it from here.
Okay, thanks, John. Morning, everybody. So we have, like Kristen, and thanks, Kristen, for so much information. We tend to put a lot of information on the slides because we're not going to spend time reading them to you, and we want you to be able to digest it and, of course, share it with your other team members. And so I won't be reading every line, and we'll go through this pretty quickly, but certainly if there are questions, we really want to encourage you to use that chat box. I see it's pretty active today, so that's great. So HUD keeps issuing guidance to us, and they provided some guidance on prioritizing permanent housing during COVID-19, and Connecticut Rapid Rehousing Prioritization was cited as a national example. So I'm gonna skip the rest of the slide. No, just kidding, but that obviously the idea is to prioritize people who are at higher risk of getting sick with COVID and then also having severe symptomatology. They've also issued guidance around prioritizing people for permanent housing and trying to coordinate with other systems of care where people may be coming out of those systems of care who need permanent housing, trying to speed up the application and access process by dealing with some of the ID and documentation requirements, only requiring what's necessary, trying to reduce any barriers. And of course, making sure everyone knows any changes in prioritization. I mean, I think Connecticut, the CAN structure really enables good communication. And within your CANs, whatever you're doing to facilitate access to permanent housing, obviously you want to let everybody know that, and ultimately document those changes in your written policies. I just will say one thing about COVID is there's lots of changes going on. There have been waivers implemented, and it's great because it's helping us serve homeless people quicker, faster, better, which is what this is all about. But you do need to document things, and I'm just going to channel Alana for a second, who said, you know, don't wait till you write all the policies, but you will need to have policies for any changes you make. So I just wanted to do a commercial on that and say that wherever we can, Housing Innovations will provide samples or examples that people can work from. And anybody wants to read all this new guidance from HUD on coordinated entry, there's a link. One other item, and CCH has a webinar on Monday on racial equity during COVID, and consistently, as HUD has had its weekly office hours, they've talked about really being mindful of racial equity during COVID. We know that disproportionately minorities are overrepresented in COVID cases, as well as COVID deaths in many cases. We also know something about previously how the Balance of State Continuum of Care did do on racial equity, and there will be updated analysis, and you can see some of the data from 2019, but there will be COVID-related indicators, and so there'll be a racial equity analysis around the whole COVID response. And so very important to think about that, think about making sure you're capturing the data. We do have quite the crisis, I think, of people of color with COVID-19. I'm in New York, and in particular, it's really extreme. So just pay attention to those indicators. This is a slide that John mentioned, would normally be in a steering committee meeting, which we're going to have at 12:30 today. But because this group tends to get folks who don't always come to the steering committee, we just wanted to make sure that people were aware of what the threshold for corrective action was in terms of performance evaluation this year, and the threshold around grieving your score if you think there is a reason that that score should be changed. So the information is here. Only a limited pot of people or programs are eligible to grieve their scores, and the numbers there. We are taking them on a rolling basis. And when folks are ultimately determined to be in corrective action, they will need to do a corrective action plan, but we've put them on hold right now because we know people have to focus on COVID and taking care of people. This is a reminder about emergency policies. If you are using the waivers, which I think almost everyone is, but also if you're using COC funds to pay hazard pay to your staff, which we hope as many of you are doing as can do it, who have those resources, you need to adopt these emergency policies, and there's a link to those policies. And you know, this just kind of gives a little more detail about who needs to do the emergency policies. Mostly for the emergency policies, it really needs to be the recipient who adopts the policies, because then it will cover anybody who's a subrecipient. However, notice the line in red, if you are an agency that's going to use COC funds for hazard pay, you still need to do the emergency policy about hazard pay in particular, whether or not you're the recipient or the subrecipient. So that's just an important thing to note. And we really support, if anybody can do it, paying hazard pay to the folks who are on the front lines. We have a little more information on economic impact payments. And I think people know that either people are getting things in their bank accounts or by mail. Some people are not receiving their payments. And so you can see, use this tool here to find out what's up with your money. Where is your economic impact payment? That doesn't even like roll off the tongue. EIP, what do you call that? EIP. If you did not make the dependent claim, you still have time next year with your tax return. So there's more information here about economic impact payments, and clicking lots of links. Just is particularly help as you're doing your education with the folks you're working with your staff. These EIPs are really important for people. The IRS is not calling people up or posting on your Facebook page that there's something going on with your payment. There's nobody who should be collecting a fee, and there is a way to report scammers. So in particular, because a lot of our folks who are not receiving Social Security, who may be getting these EIPs are getting them by mail. So there's that complication already, or because they may not have a bank account. Then there's this further complication of being scammed. So make sure you let folks know about that. In terms of our next up, I think that's the end of BOS. So actually I should stop and see if there's any questions before we go to our next steps part. I closed the chat box when I started doing the slides. I see one thing in the chat there. Okay, Lauren just posted something.
Yeah.
Yep.
It should
Okay.
be answered to the people were asking for the answer to the question about what to do if clients are not adhering with the safety precautions. So I posted that.
Okay, great.
All right, so then our next meeting next week is going to be trauma-informed care during a crisis with Andrea from Housing Innovations. Is that correct?
That's right.
Andrea was with us a couple weeks ago, so she did such a good job of staying in her time frame that we invited her back.
Oh boy, the gauntlet is down.
A reminder that if you have specific topics that you think would be of interest to the entire group, feel free to send us that information or that suggestion, and we'll put it in the queue if we're able to. And this is sort of a learning laboratory for all of us, and we want to be here to support you and answer any questions you might have on the ground. So the following slides, for those of you who are used to seeing them, is just more information than you could possibly digest in the life cycle of a pandemic, but we want to make sure that you've got all of that information at your disposal, as well as all of the email addresses of our tireless consultants at Housing Innovations for all the work that they do. If you want to contact them as a group, feel free to do that. If you want to reach out to them individually for specific questions around their expertise, feel free to do that. Are there any other questions? I don't see any in the chat. Wow, we're getting so good at this that we're actually going to end a little early. Don't tell anyone. We'll let you have 15 minutes of your life back, and you can tell everyone you're still on the call. We
Don't say it yet, John. One more question.
We have a question from Columbus House.
Yes, because I sped through the slides, and so the lowest 10% of scoring projects are going to be in the corrective action process, and will ultimately need to submit a corrective action plan. Only the people in the bottom 20% of scores, which cuts off at around 70.7, but it's certainly on that slide, are eligible to grieve. We can't say what the threshold is for corrective action yet until we've gone through the grievance process. If you are below 90% occupancy, that's automatic corrective action.
Right.
So that's, yeah.
We had talked earlier at an earlier call that mathematically we have to have a larger pool of folks who can grieve, so that if somebody at the bottom 10 actually gets some points back and then knocks them out of the 20% or out of the 10%, that we need a larger group of folks that will fall into the bottom 10. And we can spend a little bit more time on that at our next call at 12:30, if that makes sense. Any other questions? Okay, so I'm just going to hold back up my Superman mask for those of you who can't see me, just to symbolize that we so support you all as our superheroes. We thank you for all the work that you do day in and day out, and we applaud you. We hope that you're taking good care of yourself and those that you meet. And some of you will see at 12:30, other of you will see next week. So
just for the female superheroes?
Batman, not Superman. My apologies.
And Wonder
Excuse me. So Alice brought Wonder Woman there. Superman doesn't wear a mask, I don't think.
No, it was Batman. What do I know for my superheroes? Hey, wait till you see what I wear next week. That alone will be worth you guys jumping on the call with video.
That's why I come.
All right. Thanks, friends.
Thanks, everybody.
Bye,
Take care.
everybody.